Welcome to Health Empowered, the podcast where I dive into all things health, physical, mental, emotional, and spiritual. I'm Audriana, a trauma-informed physiotherapist and yoga teacher. On this podcast, I'll be interviewing experts in their health fields and humans living through healthcare experiences to provide you, the listener, with education and heartfelt stories. Let's learn together. Today on the podcast, I welcome Alex. Alex is the owner of Tidal Motion Physiotherapy in Victoria, British Columbia. She holds a Bachelor of Fine Arts from York University and a Master's of Science in Physical Therapy from the University of Alberta. Her career has spanned both public and private practice, though she currently focuses on pelvic health and dance physiotherapy. Today, we dive deep into pelvic health physiotherapy and all the benefits that you can get from it. I am excited for you to learn from here. Let's get to learning. Hi, Alex. Welcome to the Health Empowered podcast.
Hi, thanks for having me.
I'm so excited to have you. The listeners don't know that you and I actually met in physiotherapy school. We went to school together, and now we live in the same place. And I have actually seen you for pelvic health physio, and you are a wealth of knowledge. So I am so excited for other people to learn from you.
Well, I'm really excited to be here. And yeah, it's been quite a journey to go from Edmonton back to Victoria and come full circle.
Yeah, definitely. I was hoping that you could start by sharing why you decided to go into pelvic health physio, and perhaps even just explain what pelvic health physio is and what it does, because I guarantee you there's going to be people who have no idea what pelvic health physiotherapy is.
Sure. So pelvic health physio, maybe I'll start with that. Pelvic health physio is really similar to regular physio and then completely different from regular physio as well. And when I say regular, I guess I mean orthopedic physio, the physio that a lot of people have probably been to. So we treat the pelvis. The pelvis has a bunch of different functions. It helps control bowel and bladder. It has sexual functions. Babies come out of your pelvis, and the pelvis also shifts weight from one side of your body to the other when you're walking or doing any activity. So we treat all of those things. The pain with hips and low backs that comes from having some issues with transferring weight back and forth, that's something that most physios will deal with, orthopedic physios, so that's not too different. We use manual therapy, we use exercise, just like somebody would in a regular like sports physio setting. It's the bowel and bladder, the pregnancy, and the sexual function that kind of sets us apart. So we do a lot of like behavior modification or habit tracking and habit changes for poops and pees. We talk about poop and pee a lot. We'll talk about sexual function a lot more than an orthopedic physio would. And the biggest thing that sets us apart is the internal exams that we can do. So and I can talk about that a little bit more later, but I went into it because all of those things that we can treat in pelvic health, I'm really passionate about. I think they make a really big impact on people's lives when we can change them, when they're having a negative impact on people's lives. And I just kept seeing people in clinic that had these issues that also had hip and low back pain. So I would refer them to the pelvic floor physios that I worked with. And I got really good feedback coming back that, oh, this was so great. It was so helpful. Thanks for referring me. And eventually I just thought, I should be doing this myself. So I guess, I got into it because we deal with some really cool stuff that I wouldn't normally get to deal with in regular orthopedic physio.
Yeah, and I agree with you. I think a lot of the things you mentioned are very important aspects of life, right? Like our bowel, bladder functions are things that are happening every single day. So if there's issues with that, it's great to have other options that people can go see, which is amazing that pelvic health physios can deal with that, as well as the sexual function that you mentioned and pregnancy, postpartum. All of those things are things that a lot of people experience. And it's nice to have that extra option of a healthcare provider that people can see.
Yeah, and a lot of people experience them, but they don't talk about them, right? That's the other thing, is that there are huge aspects of our life that we deal with every single day, but it's embarrassing to talk about. So a lot of people just kind of live with these issues that have a negative impact on their quality of life. They don't talk about it. If you have back pain or you have knee pain, or even if you have, headaches or neck pain or a toothache, you're going to talk to people about that more than likely. And people will say, oh yeah, I've experienced that before. But to talk about your painful poops or your painful sex or, leaking every time you laugh or cough or walk sometimes, there's probably a lot of people out there that are experiencing it, but nobody's talking about it. And I can tell you from my caseload that there are a lot of people who experience it. Nobody talks about it. So it's neat to be able to be that person that people can talk to and kind of give them that relief of, oh, finally, I can talk about my poop with somebody.
Yeah, definitely. So nice to have that safe space and that safe person to be able to discuss that with. In your experience working as a pelvic health physio, I know we've chatted about, bowel, bladder, sexual function, pregnancy, all that kind of stuff. What are the most typical or most, quote unquote, common things that you help people with? And why do you think that they are common, or why do you think they come up so often?
So I'd say the number one thing that people come in to see me about is leakage. So what we call stress urinary incontinence. So all that means is that when you have stress on your pelvis, pee comes out. So whether that's coughing, sneezing, laughing, jumping, running, walking, um, if you're leaking urine even just a little bit when you're doing any of those things, that's called stress urinary incontinence. So that's super common. There's also urgency. So urgency with incontinence or without. So that's if you have all of a sudden, without warning, oh my goodness, I have to go to the bathroom and I have to go right now. Nothing else matters, and I might not even make it to the toilet. We call that urgency. And then if it has incontinence, urge urinary incontinence. So we see that a lot. Those are probably the two most common things that I see. As for why they're common, I think a lot of times it's postpartum and menopause. So people that have had babies and their pelvic floor has changed because they've either birthed a baby, had a C-section, which can have an impact on your pelvic floor. And a lot of those people are lactating, so they're either breastfeeding or pumping, and that has an impact on your pelvic floor. So a lot of those people will come to see me. And then menopause also has changes, or it changes your vaginal tissue and how your pelvis kind of works together. So some people will be totally fine, and then they hit menopause and they start to have some leakage. So those are the two, I guess, most common scenarios. Hormonal changes. And then the other really common one is people that have never been pregnant or in their like early 20s, have never gone through menopause, and they're leaking when they exercise a lot. And those people, it's a completely different issue. It's not hormonal. It's usually that they're just working out so much. Their muscles are so tight, and things aren't working together super, super well. So that would be the biggest, is stress urinary incontinence. Yeah.
Yeah, the one about the younger people, like when it's not a hormonal thing, I bet you that's a lot more common than people think, but something you wouldn't really think about, right? I think when people think about pelvic floor dysfunctions or issues with the pelvic floor, the first thing that pops in the head is pregnancy, or potentially menopause. But I think pregnancy is probably the biggest one. So it's great to bring awareness that those things can happen regardless of if you have had a child or you have not had a child.
Yeah, and I think it's easier for people to talk about it when they've had a baby. Like I think that postpartum period, it's still hard to talk about, but it's way easier because it's become a meme kind of, right? Like how many Instagram posts do you see about moms sneezing, crossing their legs, and then, wagging their finger at their toddler saying, "You did this to me." It's become funny. Um, and it's nice that we can joke about it and talk about it, but at the same time, you can change it, you can work on it. But I think it's easy for people, or easier for people, to talk about it postpartum. It's not so easy for people to talk about it in their 20s, right? Because they kind of think, well, why is this happening to me? But I think it actually, especially in the CrossFit world or like really high intensity athletics worlds, like it's very common. Actually, fun fact, the sport that has the highest incidence of stress urinary incontinence is actually trampoline, where like over 90% of Olympic athletes that are competing in trampoline have pelvic floor dysfunction, meaning that they leak when they jump on the trampoline. And not all of those people have had babies. So I think it's super, super common, harder to talk about in their early 20s. And then I think menopause as well. The other thing that I'm noticing with treating a lot of postmenopausal people is that as And I'm going to say women, because we really only talk to women about these things. If you're somebody with a uterus and you're in high school or elementary school, you're learning about your period, right? You're maybe kind of learning about pregnancy and childbirth, not nearly enough, but it's talked about a little bit. Nobody teaches you about menopause. So by the time people go through menopause, they're wondering what the heck is happening. They don't know what to expect. All of a sudden, they're leaking. And if they didn't know that that was something that could happen, that's really scary. Maybe prolapse becomes an issue. So, prolapse meaning the shifting of your pelvic organs, so your bladder or your rectum or your uterus into your vaginal canal. If they're all of a sudden saying, I had my kids 30 years ago, why am I suddenly having all these symptoms? They really don't talk about it with their friends, right? If they did, they'd probably notice that everybody's having similar experiences, but we don't talk about menopause. We have no preparation. So talking about it at that point is just even harder.
Yeah, that's something I've even noticed in my practice. Like I don't do pelvic health at all. I do chronic pain, but I have a lot of women going through menopause in my practice, and every single person's consensus is like, why has no one ever told me what to expect going through this? So 100%, that's a whole other podcast, but maybe I'll get someone on here to talk about menopause because I think it's something that we need more information on.
Absolutely. And everybody's experience is so different, right? I think that's the big thing is that with pregnancy and with periods, there's some common threads, but with menopause, it can be, all over the map. So, and pelvic floor physios, we see a lot of it. Those are our populations, pregnancy and menopause. If you're someone that sees uteruses or vulvas, I should say, there's lots of changes and yeah, there's not a lot of information. So.
Yeah. Continuing on with pelvic health, what are a couple things that you wish that the general public knew about pelvic health that people don't know or don't talk about? We've touched on a few things, but is there a couple common things that you think people should know about pelvic health that they don't?
Yeah, so I think pelvic health physio specifically, I think the biggest thing that I would want people to know is that we as pelvic floor physios don't embarrass easily. So if you're having these issues, come and talk to us. A lot of people will come in and say, I don't know if this is TMI or too much information. It's not a thing. It doesn't exist inside our treatment room. I have yet to meet a pelvic floor physio that gets embarrassed. And if we did get embarrassed, we shouldn't be doing this work. So I think that's really important for people to know that even if you think that what's going on is weird or strange, come try us because we'll probably sit there going, ooh, interesting, tell me more. We're not going to think you're weird. We're not going to think you're odd. We're not going to kick you out of the room. We're going to want to try and help you through it. I think, yeah, that would be really important that if you're struggling, come talk to us or talk to your doctor. And you don't need a referral to see us actually. So you can talk to your doctor if you want to, get some medical things cleared, but otherwise, come talk to us. We love it. We don't embarrass easily. We've all been through the exam because we don't have models on our courses. So if you're sitting in front of a pelvic floor physio, we've been through the internal exams as well. So that's, I think, one of the biggest things that I would want people to know. Another thing is that everybody has a pelvis. I think everybody thinks of pelvic floor physio as only being for women specifically. It's for everybody, all genders, no matter what your anatomy is. What I like to tell people is that it doesn't matter what is in or on your pelvis or what you do with it. If you have a pelvis, we can help you. There are definitely physios that see more pelvises with vulvas and more pelvises with penises, but there is help there for everybody, regardless of your anatomy. Um, and also, pediatric pelvic floor physio is a thing. It doesn't involve internal exams. It can sometimes involve some biofeedback. I don't do pediatric pelvic floor physio, but I think that if you have a kid or know a kid who's struggling with bedwetting or with constipation, a lot of kids deal with withholding poop. I was one of those kids. If you have kids or know kids that are dealing with bedwetting, they don't just have to wait it out. Even if their doctor has said, oh, they'll grow out of it. If they are struggling and they want to go for sleepovers and they want to go and do stuff like sleepaway camp and they can't because they're bedwetting, go see a pediatric pelvic floor physio. They are awesome and it really, really helps. And I don't think a lot of people know about them. So, yeah.
Yeah, I knew that like pediatric pelvic health physios existed, but it was something that definitely was in the back of my mind. Like you bring it up and I'm like, oh, right, totally. That makes complete sense that they would help with those things. But I think, yeah, children, unfortunately, maybe in that scenario get less looked at or less thought about compared to the pregnancy, like we talked about.
They do, and I think it's considered so normal in childhood that, if you're 5 years old, you're wetting the bed. And I guess that, they don't consider it necessarily atypical until after age 7 or 8. But if it's affecting the kid's life and we can try and work on it, then why not? It's just like adults. I guess that's the other thing actually, is that, you know, I think pelvic floor physios we're such big cheerleaders for our profession that if somebody is leaking, we're the first ones that are going to say, oh, we can help you. Come see us. Like, we can fix this. At the same time, if you're not in a place that it's a priority for you, if you're leaking and it's not affecting your life negatively, or maybe there are other things that you want to prioritize in your life before dealing with the leaking, that's okay, right? Just because something isn't normal and just because there's something that you can do about it, you don't have to if it's not a priority, right? I don't feel like we should shame people for maybe not wanting to deal with that little bit of leakage right now. Like, you can deal with it when you're ready, right?
Yeah, totally. You never know what's going on in someone's life. They might have a lot more pressing matters or more stressful things that are at the forefront of their mind. And yeah, exactly what you said. Maybe that leakage will come later to deal with. Are there any, I know we just chatted about things that you wish people knew more about. Are there any common myths that you see about the pelvic floor, about pelvic health, that you wish were demystified for people?
So many. So I think the biggest one is that incontinence is never normal. So once you're potty trained, and maybe once you're through that bedwetting phase up to age 7 or 8, and like I said, even then there's stuff that they can do to help. But once you're potty trained, leakage of urine is not normal. I think we've kind of said, oh, as you get older, you're going to leak urine. That's normal. No, it's not normal. You've had a baby, you're going to leak. No, it's not normal. It's never normal. We can try and work on it. Can I guarantee 100% resolution for everyone? No, but it's definitely not normal, and there's lots that we can do to try and manage it. Um, Especially the older generation, I feel for them. As you get older, you're peeing your pants, and people are saying, "Oh, you're 80. Sorry, that's just what you have to deal with." No, we can work on that, right? There's maybe different strategies for an 80-year-old with maybe some dementia than a 21-year-old who's doing CrossFit. Different strategies, but still lots that we can do. So yeah, incontinence is never normal. It's common. It's never normal. The other really big myth, I know you and I have talked about this, is that everybody should be doing Kegels. So everybody should be doing pelvic floor contractions all the time. They're very important. You got to get the pelvic floor strong. That is probably the biggest myth, actually, because doing pelvic floor contractions when you haven't been assessed by a pelvic floor physio can actually cause more symptoms and can cause more problems. Um, a little tag along myth with this is that pelvic floor physio is only about having a strong pelvic floor, and that the stronger your pelvic floor, the better. The problem with that is that strength is only one part of the equation, right? We look at strength, we look at control, we look at endurance, we look at how relaxed the muscles are able to be. We don't just look at brute strength, right? So if you're doing only Kegels and you're not necessarily doing them well, you could be creating a pelvic floor that has so much tension in it that it actually creates more incontinence, more back pain, more hip pain, more pain with sex, more constipation. Like a really high tension pelvic floor is a really unhappy pelvic floor. So the arbitrary advice to just do your Kegels every day is just the worst advice. The worst. It's not helpful. So that's the biggest thing. If you take nothing away from this podcast, don't just go do Kegels unless you're under supervision with the pelvic floor physio.
Totally. I know that was like my own personal experience. Was that I think we realized my pelvic floor was overactive, right? So you're not wanting to just continuously sit there and do Kegels in that situation. There's lots of other things you want to work on, which with the
Exactly.
help of a pelvic floor physio, you can know the specific things you want to work on. Yeah.
Exactly. And I think that the part that goes along with that as well is that, you know, a pelvic floor with lots of tension, it's sometimes not as simple as, oh, we'll just relax it, right? There's a lot. This sometimes, yeah, it can be muscles. It's learning how to relax it. It's looking at the hip and the low back. And, are there things that we can change there with more traditional orthopedic physio intervention? So exercise, manual therapy, needling with some people. The other part of that is that your nervous system, your emotions, your mental health, your emotional health, your stress levels, all of that plays into your pelvic floor. Your pelvic floor muscles are really responsive to the stress that your nervous system is under. So there's the very common thread with your practice with chronic pain. A lot of the same things that you're doing with your chronic pain patients, we're doing with our pelvic floor patients to try and relax that tension. So it's not as simple as just, well, stretch it out, sit on a tennis ball and release it. It doesn't normally work.
Yeah, completely. Another myth, I'm assuming this is a myth, and you can let me know if this is a myth, is that it's normal for sex to be painful.
Oh gosh, huge myth. Sex should only be painful if you want it to be painful and you get pleasure from sex being painful, right? Like that's a lot of people in the kink community, right? There's pain that's involved that is a really good thing and it's consensual and you want it. That is one thing. But if sex is painful and you don't want it to be painful and it doesn't bring you pleasure, no, sex should absolutely never ever be painful unless you want it.
Yeah, I think unfortunately for a lot of women, at least people that I've spoken to, yeah, sex will be painful. And like you've talked about, it's not something that people talk about as often, or they just think, oh, I have to grin and bear this, or this is normal. This is what it sometimes feels like. So I think it's really nice to know that pelvic floor or pelvic health physios can help with that. And of course, there's other things that can help with that too.
Absolutely. Yeah, definitely. There's tons, and there's tons that pelvic floor physio can do. Sometimes we will help our patients find other resources. So whether that's sex therapists, which are really awesome to help with kind of other aspects of things that might be influencing the painful sex. But yeah, it's definitely something that I think as women we're conditioned to think like, oh yeah, it might not be completely pleasurable for us all the time, and it might even hurt a little bit, but that's fine. No, sex should be fun for everybody all the time.
Absolutely. I could chat with you about pelvic health, pelvic floor stuff forever. I feel like there's so much to talk about, but maybe we'll have you on again a different time so we can chat about some more specific things. Is there any final things about pelvic floor, pelvic health physio that you want the listeners to know before we wrap up with my specific questions I like to ask everyone?
Um, I think, yeah, the biggest thing I touched on this earlier is that pelvic floor physio is for everybody. If you've got a pelvis and you have a problem, come talk to us. Um, that's the biggest thing. A lot of people don't realize that they even have dysfunction, right? If you are leaking, if you are constipated, you have hemorrhoids, if you've got any sort of pain, hip, low back, all of that can be related to pelvic floor. So if you're curious, come chat with us. Internal exams, even though it's a big part of what we do, they're not mandatory. So if that's something that is concerning to you or you're nervous about, still come talk to us. We're never going to do it without your consent. And actually, something that just popped into my head, if you're somebody with a vulva and having a speculum exam is painful, that's another thing that we can help with. I know pap smears are changing a little bit in BC this year, but so they might not be required. But if you have had a speculum exam, need to have a speculum exam, and that's painful, we can help with that. Those should not be painful either. Uncomfortable, sure. No one's gonna love having a speculum open in your vagina, but it should not be painful. You should be able to, you know, get through it without cringing and wincing.
Amazing. Thank you so much for all the wonderful information and for just being a great advocate for pelvic health physio in general. It's so nice to get other people to learn more about your profession.
We love what we do. We all love what we do so much. So we're all cheerleaders. We're all advocates. I think if a pelvic floor physio wasn't an advocate for pelvic health, shouldn't be doing the work.
Totally. Yeah. My last questions for you, the ones that I like to ask everybody. First one being, has there been one book that you've read recently or a podcast that you've listened to lately that has educated you on your health that you would like to share with the listeners?
Yeah, so it's kind of both. It's a podcast and a book, and I'm not through it yet. And it's nerdy of me because I'm reading it for work, but also just as a woman, I think it's important. But Come As You Are by Emily Nagoski. is about women's sexual health and the physiology behind female sex drive. Fascinating. She's also turned it into a podcast. So if reading a book is too much for people, the podcast is a little bit more accessible to, listen to you while you walk. But I've learned a lot about how sexual health or sexual drive and sexual physiology is different between men and women. And yeah, super fascinating. I'd recommend it to everybody, not like anybody of any gender, not just people with, a vulva.
Yeah, I've read that book actually. It was really good. I enjoyed it a lot. Yeah. Amazing. And my final question for you is, what does empowered health mean to you?
I think this plays really well into pelvic floor physio, actually, because I think having good pelvic health means that you're empowered to take care of your pelvis. I think in our day and age, we've kind of created this world where we strive for health, we strive for a health that means that we have no pain and no disease. And I think empowered health is living well and thriving in spite of inevitable pain and disease, because we're never going to be disease free. We're never going to be pain free, but we can live well in spite of all of that. So rather than, seeking the latest cures and the latest hacks, I think that we should be empowering ourselves to find ways of living meaningfully and really well while all of that is going on.
Cool. That's a really interesting way of looking at it. I like that.
Yeah, I think the wellness industry has gotten to the point where they kind of promise things that aren't going to happen. But if we can, find meaning and live well in spite of that, then we're truly kind of taking control of our lives and our health.
Yeah, definitely. Well, thank you so much for coming on, Alex. I learned so much from interviewing you, so I'm sure other people are going to learn so much. Quickly before you go, where can the listeners find you? You can give us social media, website, anything you'd like to share.
Sure. So I own Tidal Motion Physiotherapy in Victoria. So I focus on pelvic health and dance physiotherapy. That website is www.tidalmotionphysio.ca, and I'm on Instagram at Tidal Motion Physio.
Amazing. I will add those to the show notes so that everyone can find them.
Excellent. Thanks so much for having me.
Yeah, thanks so much for coming on. I'll chat with you soon.
Thank you so much for listening to this episode of Health Empowered. To support the show, please rate, review, share, and subscribe. And if you're looking for support on your health journey, visit my website, empoweredmovement.ca. Have a great day and stay empowered on your health journey.